Good afternoon, everyone. I'm Gowrishankar Palaniswamy, one of the medicine residents at Medical University of South Carolina at Lancaster, a PGY1, here to present my work in the upcoming AACR, one of our original AA works done in the field of lung cancer detection called LUCID. So the question was simple when we tried to come up with this idea, why could we want to bring something new, something technical, or something lung cancer has been on there for ages, but when everyone were looking at the treatment part, we were looking at the statistical part of it for a second. Because every 2 minutes, someone in America is told that they might have lung cancer. And for the majority of them, unfortunately, the diagnosis comes way too late. Today, I want to share like how artificial intelligence can change the story and how we can make the technology accessible to clinicians everywhere, be it like in a big university setting or be it in a small community hospital. Our aim is for the doctors to have the support and power as they would if they are in a bigger university, even if they are in a community setting. Because lung cancer has a very poor survival rate, it's one of the most common cancer causing number one mortality with cancer related deaths globally, actually, not even in the United States. It's a global phenomenon. And the primary reason which we believe in the most of experts believe is the late diagnosis, unfortunately. Only one third of the lung cancer patients are diagnosed very early enough for an effective treatment. And we have a detection problem which we wanted to solve. And coming up from a community hospital affiliated with MUSC, we wanted to take it a deeper drive because in our community, the lung cancer is quite prevalent given the history, strong smoking history over here. And we wanted to use the deep learning, which we believe was had the unique position to solve this unique equation, I would say. So what we did was to develop a unique model, which was original in nature, called LUCID, which stands for Lung Cancer Intelligent Detection. And how do we build it? It is based on one of the deep learning algorithms or a deep learning models, we would say, called Efficient B0, which is like a byproduct of the Google company. And it's also like a state-of-the-art convolutional neural network, which also won like major winning awards in the artificial intelligence field. Just for the detection, it can be used in the imaging analysis. And a lot of questions might ask, what exactly is going to make this unique? What exactly is going to make it better than all the other people are doing over there? My aim was quite simple. When we met our team, in our AI team, to build this model, the first thing that we had in our mind, every doctor in the world who has access to a simple internet connection. It need not be a powerful Wi-Fi or a powerful computer having a costly GPUs. It should be as simple as the computer that you work every day to be able to use this AI, and it shouldn't require difficulty setting up or anything. It's as simple as a child who's just learning to learn computer would be able to use this model. We just didn't stop there with the model. We built a practical application out of it. And the good thing is we were able to maintain the results that we came with the model as well as in the application as well. And this is an energy efficient model which is efficient at B0, and it runs at economically much lesser cost and almost provides as much precision and accuracy as you would expect from someone with the bigger models or a bigger billion parameters, I would say, with the deep learning models that are coming nowadays. But how did we do it? That's the main question when it comes over there. We tried to collect like around 1,190 anonymized CT images. We split into three categories, 60, 20, 20, into the training, validation, and the testing cohort. And all these images were anonymized and pre-marked with expert pathologists and radiologists, the actual diagnosis that were behind the CT images. The patient informations were completely anonymized, so there was no concerns for any patient information or HIPAA Act being violated anywhere in the study, even though the study was done like outside the MUSC network at this point. And surprisingly, we could find that all the statistical parameters, be it the F1 score, the AUROC curve, or the F2 score, sensitivity, specificity, everything reached almost a unity of 1, meaning it had almost zero misclassifications. We gave the model 140 lesions in the N as a validation and the external validation to test how well this application is being performed once the model is created. And it accurately detected each benign lesion and malignant lesion just based on the CT over there. which clinically meaning zero false positive and zero false negatives. And this is the impact we believe the LUCID is going to make. Why? Because it's simple, easily computable, usable on your phone, your computer. You just need a simple desktop browser to be able to use it in the same efficiency as someone at Google or Microsoft would be able to use it. It might come into the question, how is it going to change the paradigm of the practice? Because I strongly believe this has a huge impact to be made. Because I believe we are living in an age where not only the medical components are going to change medicine per se, but also the technical aspect, given the recent advances. As physicians, when we start to incorporate in our day-to-day practices, I believe it's only the patient who's going to receive the best possible care in the end. Because I believe as a physician, each one are aiming and striving towards that one particular goal. And even a community hospital like in our Lancaster, our goal is to have like the South Carolina should have access to the same AI-powered detection, which is even available in the biggest of the academic center of the entire world. Imagine both using the same model, able to have the same diagnosis at the same time at a much better accuracy all around the world. It's a win for the patients, I would say, and the medical fraternity as well. But this too comes with a lot of challenges when we try to implement as well. But I began with telling you, like when we started this initial conversation, that every lung cancer is being diagnosed every 2 minutes once in the United States. And that states the importance of a lung cancer diagnosis more than the treatment, because you need a diagnosis first to have a treatment done for the proper recovery of the patient, as well as to prevent the mortalities that can tie up with later stage diagnosis. As most come too late, but I strongly believe LUCID represents a paradigm shift, a clinical grade AI that reaches patients regardless of the geography or the resources available anywhere in the world. I believe we have the technology to change the 2 minute story which is happening right now. So my goal, our team goal, is to make sure every diagnosis of lung cancer or any other cancer should come in time for the patient. And that's it to be it. And we are happy to present this work in the AACR on the 20th of April. And we are really happy to meet you all over there with the abstract presentation session. And thank you for this wonderful opportunity to MUSC Charleston team.